More people in Hong Kong are heading to mainland China for healthcare, where treatments are said to be cheaper and appointments are quicker. To tell us more about this, we are joined by Dr. Milan Sabnes from Frost and Sullivan. Dr. Sabnes, tell us what has been changing in Hong Kong's healthcare scene lately.
All around the world, patients essentially are looking for three things: high quality, low cost, and higher access. So the Hong Kong patients are no different. And Hong Kong healthcare actually offers them really high quality healthcare. However, private sector is very expensive and public sector is overcrowded with the long waiting times and so on. So uh, these patients typically go to mainland China, where the quality is improving now, and also the cost is lower and the accessibility is much quicker. And what has changed, to answer your question, is that the COVID, post COVID, the borders have opened up, and also patients who are not only low income but also middle income have started moving towards mainland China because the quality there is improving and the cost is much lower. I mean, to give you an example, a cancer treatment could cost less than one fifth of what it is charged in Hong Kong, and the waiting times are much lesser.
Can you expound on this? How does the quality of medical care within mainland China compare to what is available locally within Hong Kong?
I would like to break this down into two parts. One is the primary care, and the second part is the tertiary care, which is the hospital part of the thing. So, from a primary care point of view, the mainland China, especially places like Shanghai, are kind of better than Hong Kong in a way. But if not in other parts, if not better, at least similar when it comes to primary care, which is your clinics and everything. However, when you look at hospitals, obviously all Hong Kong hospitals are high quality, and China hospitals, mainland China hospitals, are trying to get there, and they will in a few years time. But currently not at that level. However, the patients that are going to China are typically more chronic, and also those ones who are going for the primary care part of it.
So, is there anything that local providers can do to get people to stick with treatments here instead of heading across the border?
Of course, I mean, if you look at the three things I mentioned, right, in terms of quality, Hong Kong is already there for the hospitals. But for the what needs to be done in terms of quality is trying to make the primary care more accessible, and more options available for the Hong Kong patients. What has happened is, if you look at the hospitals that in the emergency room, about 60% of the patients that come to the emergency are non-emergency. So if you move these patients away to primary care, then the hospitals can get freed up, and that's how you can improve the access. So there is a need for strengthening the primary care, and the government has started doing that. It's just that it will take some time. And what also potentially needs to be done is inclusion of technology. Telemedicine can actually help quite a bit, because then you are using your resources optimally, saving travel time, and essentially it's a win-win for everyone, for the patient, for the doctors, and for the convenience of the patients as well. So and then obviously there are other healthcare apps that they could use, but this is the way to go. That is from an access point of view. From a cost point of view, there could be a few things. For the private sector, there could be some kind of transparency of pricing, so that the patients know exactly what is on the offer, so that they can titrate their treatment. And also, from a subsidy point of view, if there is a possibility to enhance the subsidy for the community health assistance schemes, for example, then that could be quite helpful. Um, in terms of other things that could be done, there could be a potential way to collaborate with the mainland China healthcare facilities. Because in mainland China, there maybe the patient might not have to travel there. You could use telehealth to talk to them, and when it comes to operating, they could use the Hong Kong hospitals. So that way, the burden on the Hong Kong hospitals would be kind of reduced. Because currently the way things are going, for an emergency patient, you have to wait for 8 hours before you are admitted to the hospital. Or sometimes for elective surgeries, you have to wait for almost an year and a half to get something like a hip replacement or a knee replacement done. So the patients are not going to wait for that. So essentially, some kind of collaboration to help ease out the burden, whether it's the primary care within Hong Kong, which might take some time. So there could be a potential for collaboration with mainland China to see the primary care patients, but when it comes to follow up and surgeries and everything, that could be done well in Hong Kong, where the quality is higher and it's closer as well.
Thank you so much for sharing your insights, Dr. Sabnis.
Thank you so much.
Once again, that was Dr. Milan Sabnis, Head of Advisory for Healthcare at Asia Pacific at Frost Sullivan. For more news, visit healthcareasiamagazine.com.